Good afternoon. I trust that you are well. Kenya, Uganda, Tanzania. Welcome to TV47 News Now, afternoon bulletin. We have a lot lined up for you, but here is a snippet of what is coming up. Members of Parliament debate the report by the Joint Parliamentary Committee on the suitability of Douglas Kanja for the position of Inspector General of Police.
Appointment of Mr. Douglas Kanja Kirocho as the Inspector General of the National Police Service.
Ministry of Health remains firm on moving forward with the new Social Health Insurance Fund, despite recent abrupt leadership changes at the Social Health Authority and with just 12 days remaining before the fund's rollout. Legislators clash over Treasury Cabinet Secretary John Mbadi's absence from Wednesday's Senate session, where he was scheduled to answer critical questions from lawmakers on national issues. Once again, good afternoon. It is exactly 1 minute past 4 p.m. East African time. Welcome on board. We have a lot lined up for you. We are coming to you live from our broadcasting center here in Nairobi, Kenya. My name is Moige William. Now, let us keep you informed. We start off from the National Assembly, whereby today it has approved that Douglas Kanja Kirocho as the Inspector General nominee. Kanja will be sworn in on Friday and is expected to commence work next week. He will be taking over from Japhet Koome as the 5th Inspector General since the promulgation of the 2010 Constitution. Members of Parliament have urged Kanja to address the challenges facing the police service, such as the welfare of police officers and corruption.
Section 12(1) of the National Police Service Act, Cap. 84, and Section 8 of the Public Appointments Parliamentary Approval Act, Cap. 7F. This House approves the appointment of Mr. Douglas Kanja Kirocho as the Inspector General of the National Police Service.
It is also coming at a time when there have been questions of the police handling of lawful demonstrations and picketing in terms of use of excessive force. But Mr. Speaker, I have examined the report of the committee and looked at the CV of the nominee, and I would say I'm impressed. I'm impressed first, Mr. Speaker, because from all the reports, this nominee is without blemish in his 39 years of service. That is not easy for a policeman. That is not easy for a person who has even been a Deputy Inspector General and a Commandant of the GSU. That is rare. Mr. Speaker, I'm also impressed because this is a person who you'd say has risen from humble beginnings in the service, from the lowest possible level as a constable to come up to this high level. It is not easy.
Away from that now to matters health, and most especially the new SHA, that is the SHAM as it is now known. The Ministry of Health remains committed to launching the Social Health Authority program on October 1st in an engagement with the media. Ministry of Health officials told journalists that so far only 1.2 million Kenyan households have registered, but they are optimistic the numbers will rise before the official rollout date. Unlike the NHIF, the SHA benefits will begin immediately upon registration. There is a key improvements, including enhancements of the Linda Mama program and the Edu Afia program, which will now cover all school-going children under the new scheme. 2.75% of the household income will be deducted each month with a minimum contribution of 300 Kenya shillings.
Fundamental departure from what we had before is that the SHA benefit package is the same package for all of us. We don't have packages for special groups of persons. So the benefit package is the same for all Kenyans and all people residing in Kenya.
But important to note here is as of 16th September 2024, we have 1.2 million Kenyans who have registered voluntarily.
We have mapped
level 2, level 3 hospitals that are closest to each consumer into private healthcare networks. We are working hard to ensure that service in these providers is good enough to ensure that everybody is able to get service at the right time.
And therefore, our proposal as Council of Governors, let's think of an arrangement where it is possible to have drugs through a funded system to the counties. Do you have banks that are willing to do that? Who will give us a guarantee? Can the national government talk to friendly banks and tell them, as long as money is going to drugs, pay KEMSA for this county, and the exchequer is released, you will be the first charge.
In other news, students from the Multimedia University and a section of human rights activists have condemned a police brutality carried by police officers against the students during their Tuesday's protest. The school's student leaders are now calling upon government and the National Police Service to ensure that justice is served to Trevor Muridhi Madenge, who was brutally harassed by police officers, an incident that left Trevor sustaining an ankle fracture. The students have vowed not to relent until justice is served to Trevor Muridhi, who is currently undergoing an ankle surgery at the Rongai orthopedic facility.
Justice for Trevor. Justice for Trevor. Justice for Trevor. Justice for Trevor.
What began as a peaceful demonstration, yes, a powerful expression of our collective demand for justice, yes, tragically, yes, turned into an incident of police brutality that we cannot overlook. Yes. Trevor Matenga Muridhi, yes, a first-year student pursuing bachelor degree in applied communication, yes, who is now recovering, yes, from his injuries at Rongai Orthopedic Medical Center Hospital, yes, was brutally beaten, yes, and harassed by police during the demonstration. Yes.
We are here today, yes, to stand in solidarity, yes, with Trevor, yes, and students of Multimedia University, yes, for the heinous attack, yes, merely for exercising, yes, their constitutional rights, yes, to demonstrate, yes, and to demand, yes, better services in their university.
To matters of health, once again, the AIDS Healthcare Foundation Kenya, in collaboration with other key civil society organizations, have urged the wealthier nations to stop hoarding the mpox vaccines, which has limited the supply in the African continent. The government has also been urged to leverage on technology for regional vaccine production.
This high cost of vaccine is not only an economic issue, it is a life and death matter. We have seen the devastating effects of vaccine inequality during the COVID pandemic. The vaccine hoarding by wealthy nations resulted in more than 1.3 million preventable deaths.
We are happy to call on the Ministry of Health to make sure that as this new pandemic also comes in and we sensitize communities, what is needed to prevent and treat and manage HIV is also not interfered with and supported. And therefore, this is the time to promote combination prevention, including voluntary medical, male circumcision, PrEP, and harm reduction services.
And now let us head to Mombasa County, where 2 young men suspected of theft have been arrested in Utange area, that is in Kisauni. This follows a crackdown initiated after CCTV footage was circulated online showing the youths robbing people in broad daylight and committing other crimes. Confirming the incident, Mombasa County Police Commander Maxwell Agolo reported that they have seized weapons including knives, machetes, which the suspects allegedly used during the attacks. The suspects are being held at Makupa Police Station for further investigations before being taken to court later this week.
Acting on a credible intelligence information, we managed to catch up with them at Utange area within Kisauni. This is a group which operates in Mombasa, but then they ran away in the neighborhood. The police managed to arrest them and escorted them to Makupa police station, where they are being processed and further police action to follow. Yes, the two are amongst those ones who are being wanted within Mombasa, and the police are catching up with them. It's only that we are sounding a warning to those who have got such kind of intention that the NPS will not relent until we catch up with them. Yeah, the NPS has formed up different categories and functions to make sure that they nab them both in uniform and undercover, and other stakeholders being used in security operations. We have really put up the traps so that we can nab them. Hili ni hakikisho la kwamba sisi tuko hapa tunafanya hii kazi kwa udhabiti, wasiwe na wasiwasi. Tutakweko na tuko na tutahakikisha ya kwamba usalama wao upo, wasiwe na wasiwasi hata kidogo.
Elsewhere, security officers in Turkana County have seized marijuana and 16 National Youth Service uniforms that were being transported from Lodwar town. And as Quinto Afula reports, it is alleged that the uniforms are used by terrorists to harass residents in various parts of the county.
This is the content of the cargo that was being ferried, uniforms resembling the ones worn by NYS recruits and marijuana worth approximately 50,000 shillings.
Vile hii bangi iko hapa, tuweze establish vizuri imetoka pande gani.
According to Turkana County Commissioner Julius Kavita, the cargo was hidden inside a box and covered with fish to avoid detection, with the person transporting the parcel escaping during the crackdown.
Wakati imefika kwa bus stage, tukawa na wataalamu hapo, na tunashukuru wale wako kwa stage, sana sana Taklif Courier Services, wakaanza kuona kama hiki kifurushi kiko na maneno ndani. Kuangalia kisirisiri, mwenye kubeba hii naye akawa na shauku, akapotea, akaacha pikipiki pale.
Security officers have condemned the incident, highlighting the distress caused to residents by individuals wearing the same uniforms.
Kwa hivyo kuna wale wameanza hii biashara kifaa hizi, anaanza kutisha wananchi, waambia ni askari. Hata anaweza kusema yeye ametumwa kuchukua mbuzi ama nini, lakini siku zao zilikuwa 40 zimeisha, wakanaswa na uchunguzi unaendelea na ofisi ya DCI.
Additionally, they have vowed to intensify the fight against those involved in drug trade, illegal alcohol and banditry in Turkana County.
Tutaendelea kuweka mikakati ya patrol along the borders, ili tuweze kuona kama tunaweza kuwa tunapata hao watu wakati wako na hiyo nia ya kusafirisha hizi vitu kama hizi.
Quinto Wafula, TV47.
Yeye kadeli akipata anakuwa mwisi.
Thank you, Wafula, for that report. Elsewhere, police officers in Eldoret have impounded over 83 motorcycles believed to have been stolen within the premises of the Moi Teaching and Referral Hospital as the riders take patients to the hospital in Uasin Gishu County. County Police Commander Benjamin Mwandhi, together with the DCI officers, have investigated and followed up on the syndicate, and as of now, 4 suspects have been arrested.
Kwa muda tumekuwa tukifuatia wizi wa pikipiki ambao sana sana unatendeka MTRH. Wezi ni kama wanangojea wakati mtu analeta mgonjwa, na wanajua wagonjwa wengi wanatoka area za reserve huko, tembelea huko ndani. So wakifika hapo, kiwacha pikipiki yako upeleke mgonjwa ndani kwa casualty ama kwa daktari, ukirudi hiyo pikipiki imeenda. Tumefanya uchunguzi wetu pamoja na timu ya DCI, imeweza kutulia mahali pikipiki sikiibiwa zinauzwa. So usiku hii tumeenda Kimilili in Western Region, ndio tukapata hii assortment ya hii pikipiki. Tumepata pikipiki zile ziko full, sijaguzwa ni 3, Hizo ndio zile zilikuwa zimepelekwa immediately. Zingine zimekatakatwa. As you can see, spares wanakatakata na kuuza kama spares. Kwa hii ya saa hii tumekamata watu 4. Kutoka Kimilili tulikamata 3 na kutoka hapa kwetu tulikamata mmoja mwenye alikuwa anaiba MTRH.
A man believed to be mentally ill and who roams around a Mali town in Makueni County was beaten to death by residents after he ambushed a police officer guarding a bank within town, slashed him with a machete and fled with his gun. According to witnesses, the man attacked the officer while he was using his mobile phone, hence not aware and not in a position to defend himself from the threat. The injured police officer was treated at Best Care Hospital in Emali town and later referred to Nairobi Hospital, where he is still recovering from severe head injuries.
Jamaa amekuja akiwa amejificha, akiwa ameweka ipanga hapo kwa mnini kwa suruali. Akapata askari alikuwa kwa simu, akachukua mnini bunduki, akamkata na mpanga kwa kichwa. So na kukimbia akarusha risasi zote zikaisha. Tukakimbizana na yeye mpaka na huko kwa buzi. So ile risasi zikaisha, tukamchukua, nikaanguka na yeye.
Kukimbizana na yeye jamaa mmoja wa Ndudhi akamgonga. Kuanguka chini akawekelewa mawe.
Today around 2 p.m. we received a patient. He was bleeding so profuse. So the doctor was on duty, took over the emergency, and we did stitching to him to arrest the bleeding, and I think right now the patient is doing okay. We are waiting to refer him to Nairobi West.
Elsewhere, with efforts to eliminate violence against women and girls, women from Mombasa County have been urged to strengthen their stance on the fight against gender-based violence and ensure perpetrators are brought to book, with their actions meeting legal punishment. Speaking in Likoni during a women empowerment program under the Mama Haki Foundation, Mombasa-nominated Senator Miraj Abdullahi has advised women to strive in investing and eventually to saving to alleviate themselves from poverty. Additionally, the women received training on how to manage their income, noting that mismanagement of funds has resulted in the inability to meet financial obligations.
Tujaribuni kubadilisha malengo ya biashara zetu. Na tutakapotia nia ya kubadilisha malengo ya biashara zetu, tutaenda kuona natija kubwa sana katika maisha yetu. Manake mimi najua sote biashara zetu tutafanya vibarazani. Ukweli ni urongo? Haupati mtaji wa kupata mlango, ukaweka mabenchi vizuri, ukafungua hoteli yako nzuri tu sana. Lakini je, malengo yetu kabla ya kuanza kuweka katika VSLA, tunayo malengo kina mama? Sisi tumekuwa wafanyikazi wa wenye maduka. Tunaamka asubuhi, tunachukua unga wa ngano, tunachukua samli, tunachukua chumvi. Jioni faida yote imeenda katika matumizi ya siku, tunachukua tena ule mtaji tunamregeshea tena mwenye duka. Hata kama ni baba yake amemnajisi ule mtoto, wewe jukumu lako ni kuenda kueleza serikali kwamba huyu mtoto amefanyiwa ABCD. Lakini wewe kutaka kuangalia ndoa yako, wewe kutaka kuangalia udugu wako na yule aliyemfanyia kile kitendo mtoto wako, ujue ni dhulma kubwa unamfanyia yule mtoto. Na siku atakapokuja kuishi, akapata fahamu yake, akakumbuka kile kitendo, basi ujue wewe mwenyewe hautaishi kwa amani. Tunazijua sheria, tuzifateni sheria. Na ikiwa wewe huwezi kufanya, mtonye yule mtu ambaye wajua ana ukakamavu wa kuweza kukusaidia.
Sports News.
And now time for sports. The 2024-2025 season of the UEFA Champions League